I'm Dr. Ian Johnston, continuing our series on playing in the sandbox with Cerner. In our last video we went over in some detail how to complete an admission. In this video we will discuss how to discharge a patient. So here we are back in the patient's chart. The patient's been here for a little while, and after a couple of ups and downs is now ready to go home. So now we want to move from the M page, which we spend most of our time in the inpatient workflow, and we want to move to the discharge workflow. So let's do that. Now, there are many ways to do things, but to start with, it's probably best to stick with the workflow that is recommended by Cerner. You will probably find fewer frustrations doing it that way than trying to do each item individually. So if we work from top to bottom, the things that we absolutely have to deal with are ones that have the asterisks beside them. So let's start with our problem list, which has actually a green check mark beside it, but it's worthwhile at the end of an admission to look back and see if anything else has happened which would affect the problem list and affect the coding for this patient. So let's pretend that this patient developed some atrial fibrillation during this visit. So we'll search that, and sure enough we find atrial fibrillation. So I'll add this in, and that's about all that new that happened. So we'll say that we have reviewed this, which involves just clicking the complete reconciliation button. It's a problem reconciliation rather than a medication reconciliation. So we'll check that, and that's good. Now we'll move on to the next asterisk. Now this will probably be the longest piece. This is where we need to do our discharge medication reconciliation. And we can see here our options are, if we were sending this patient to another facility, for example Windsor, if they were live in Cerner, we can do cross encounter reconciliation, but we're sending this patient home, so we will do a discharge to home reconciliation. And we see quite a long list, and part of the thing that makes this so long is the list will include not only home medications, but also hospital medications, and medications that were present both in hospital and at home will appear twice. So let's try to do this in an organized fashion. We'll start with medications that the patient was taking at home. Is there anything here that we don't want? And these are, the relatively innocuous things, and for argument's sake, we'll suggest that we want to continue all of these. So we'll click those away, and we'll move down, and these are medications which were present in hospital, but and also were taken at home. And this is a common source of confusion in that, for example, we have bupropion appearing here twice, and the reason for this is that the first was as it was entered as a home medication. The second, because it has the little hospital sign beside it, was as prescribed in hospital. So an easy way to do it would be to just continue the home medications as they were initially. So what I'll do is I'll just go through and say we'll do the same bupropion that they came in, and so on. So I'm going to continue all those as we go along. looking for the little scrolls, because those were the home medications that we continued. All right, and moving down, we have our metformin, our methadone, etc. So that's taken care of. Now, these are different PRN medications. Different medications that were taken in hospital but were not taken at home. So we probably don't want to stop the Tylenol. They can take that if they would like. The azithromycin, it depends where they are, but let's say for argument's sake that they've been in for 2 or 3 days and they still have a couple of doses left. So this person is going to need a few more pills of azithromycin. So we're going to want to send that home as a prescription. So we see here a prescription bottle. These people will get a small prescription for azithromycin. So that's fine and dandy. We see a little blue X there requiring more details, but we'll get to that later. The bisacodyl, that's just a hospital thing. They started on carvedilol because of the atrial fibrillation that they developed in hospital, so they don't have that for home. So I think we'll give them a prescription for that as well. They have finished their ceftriaxone, so that was ordered and completed. So we don't have the option of sending them with this. The enoxaparin, I think we're done with that. The same with the Senna, so that is fine. And the IV solutions, of course, we're not going to send them home on that, and we're not given the option of doing so. Now, up here we left some blank, the repeats, and rather than just clicking all the things that we aren't going to continue, we can just fill in the rest by clicking do not continue remaining medications. Now let's deal with this problem here. We want to provide a few details. They'll probably only need a few tablets, so they're going to take 1 tablet PO daily, and we'll say for 3 days, and lo and behold it figures out how much to give. The carvedilol, on the other hand, we see it's prescribed 4 tabs twice daily and we need to specify a duration. So let's say 30 days, and it calculates the rest for us. So I think we are good. We have addressed all of the issues here. We have done the prescriptions that need to be done, and I think that we can go ahead and sign this. Wait a minute, and there we go. Now let's go back and deal with the IV medication situation. Because as we all know, we do send people home with IV medications with some regularity. Although you're not given the option to reorder them in the form, we can order them by simply adding it to the prescription. So what we would do is click Add. We will be given a search bar. Let's say we want to give 3 days of ceftriaxone at home as well. We can choose here, fill in the duration. We'll say for 3 days. We'll give them 3 grams, and then we're all set and ready to go, and we can sign that. So it's very easy to add in the IV medications, but it doesn't appear on the standard table as we had above. So that's just a bit of a quirk of Cerner. Now, if you listen behind me, you hear a printer which is printing out prescriptions for these patients. In the live environment, if all works as it should, we will have the option of faxing, and we will have a dialog box around faxing prescriptions that will follow signing the prescriptions. All right, so let's move back to our workflow. We now have a check mark beside home medication, so we've done a nice job there. And we will move down to follow-up. Now moving on to follow-up, Cerner insists that every patient have some sort of a follow-up, even if it's just PRN follow-up with their primary care physician. Most of you will have quick picks built out. This can be done for you at a favorites fair with common follow-ups, perhaps follow-up with yourself, follow-up with the primary care practitioner, follow-up with the lab, and so on. So for simplicity, we'll say we want this individual to follow up with their family physician. We'll choose that. And we see a default length of time set at 1 month. We can accept that, or we could modify it. If we click modify, we get a dialog box to the right. Perhaps I want this person to see their family physician in a week. I could make that change, save it, and there you go. And now we see we have yet another happy green check mark in my list. Moving on down through, we now have our order profile. And why do we have an asterisk here? It's because we haven't yet made a discharge order. So we will do that by simply going to new order, and we will type in discharge. And again, we have a few choices. We have discharge home, discharge to long care, discharge to retirement. In this case, we will choose discharge home. It goes into our to-do box. We don't need to modify details. If we look at the details that are available, we can see that we have a number of places that we can discharge. We can discharge home to long care term care facility. We can discharge to a psychiatric facility if they didn't come back from a leave of absence. We can click that as well. We have multiple choices here. If we're transferring to another hospital, for example London, we would discharge to another acute care facility. But in this case we're sending home, so that's easy enough. We will sign that, and if we go back to our inpatient workflow, we have yet another green check mark beside. This leaves us just to dictate our discharge note, and that is much the same as any other note. And in this case, most things will be filled in for us. Diagnosis most responsible for stay would probably be pneumonia. We have the active and historical problems. If we wanted to tag and drag in any diagnostics, we certainly could. We would probably want to voice dictate a brief narrative of hospital course. We have all of the hospital medications printed here for the family physician to have a look at, and we have a discharge plan. In this case, I would likely dictate a complete course of azithromycin, continue metformin as before, continue carvedilol and follow up with internal medicine. When that has all been completed, I will sign and submit. And we are given this pop-up note asking where we want this sent. It will always go to the primary care physician as well as yourself, as you did the letter. And if you wanted to go anywhere else, you can simply search for the other physician. In this case, I will send a copy to a colleague, and I will sign it. And then we have a series of check marks. We have a discharged patient, and we have finished our job.